So I just want to say a huge thank you to everyone for coming along today. It's absolutely amazing on World Mental Health Day to have already nearly 200 people joining this webinar to look at what's such an important topic around young carers who are supporting parents with a mental illness. My name's Andy Mcgowan. I'm the Public Affairs and Policy Officer for the charity Our Time, which is the only dedicated charity for children of parents with a mental illness. I'm also the Head of Engagement for the charity Caring Together, who supports carers of all ages across Cambridgeshire, Peterborough and Norfolk, and is the proud host of the Young Carers Alliance. As I said, I'm really grateful to have everyone here today. In terms of just some housekeeping, please ensure your microphones stay on mute throughout the session today. We have got a large number of people on the call, and obviously it interferes if people have got sort of phone calls coming in and things like that. Please do make sure you use of the chat. And we've got such a broad breadth of people in this call today, from young carer services to adult mental health services to local authorities, schools, those with lived experience. So please do make this the most sort of beneficial sort of afternoon you can. Because of the sheer number of people on the call this afternoon, we won't be sort of taking sort of questions and doing discussion as we're going through. However, we will be trying to answer things in the chat as we go through, and anything that's not sort of answered as we go through, we will follow up afterwards as well. And for those of you who are on Twitter, please do join in the conversation. You can see that the Young Carers Alliance, Our Time and Caring Together can all be found on there. And the hashtag for World Mental Health Day is, unsurprisingly, hashtag World Mental Health Day. So I'm just going to start a little bit by setting the scene in terms of about this particular group of young people. And I think you'll be glad to know I'm not going to read out all of the stats on the screen here. But what it really does bring to light is just the scale that we're talking about here. So the fact that 1 in 3 young people have a parent reporting symptoms of anxiety or depression. But when we're talking about children who are living with an adult with a severe mental illness, we're talking around 2 or 3 young people in every single class, in every single school, up and down the country from that sense. And I think if we were to look at any other characteristic to define a young person, whether it be their gender, whether it be the prevalence of a disability, whether it be in terms of having a mental illness themselves, when you're looking at this scale, it would be something we'd be looking at. And so the purpose of today is to really shine a light on this group and look at actually what are some of the issues, but also what can we all do about it as well. Because as you can see, it can have a significant impact in relation to, if you look at children's social care, actually in terms of 28% of incidences. So that's fast approaching a third of them where actually parental mental illness was a factor in them. And as you can see, in terms of the long-term impact for these children and young people, the outcome for these children and young people, they're 3 times more likely to have a mental disorder themselves, which shows it's such an important topic to make sure we get this right, to make sure that these children are identified, but also properly supported as well. You'll be glad to know it's not just going to be talking all about statistics and numbers. So what I am going to do is just start to really help setting the scene by sharing a really short video clip from the young people at Our Time I've worked with, just to really, in their words, show what it's like being a child supporting a parent with a mental illness.
When my dad was having episodes, we spoke the least about it then.
When the doctors used to come and take her into hospital, we never knew what was going on.
I think other people felt that we were either causing her mental illness or we could get a mental illness from my mum.
When my dad was diagnosed with it, I had no friends. I was alone. I couldn't do anything I wanted to do.
I couldn't sleep at night, so that's the reason why I used to go into school tired, and because I was so busy thinking about all these negative feelings, I wasn't eating properly, so it was just affecting my weight. And I realised that once I did start talking about it, I managed to sleep because I used to put all those feelings to rest.
So that was really just to give a flavour of actually what are some of the issues that are faced, whether it be the impact on their social lives, their impact on their schooling, or actually the impact on their own mental health as well. And as we go through this session today, it will really help to start to shine a light on some of the other issues, but also what can be done about it for this group of young people. So it's not just going to be me talking at you, it just won't be everyone else talking at you from that perspective. So we are going to do a very quick interactive poll just to see in terms of what people think. So on the screen on the left-hand side, you can see something which came from Ofsted and also the Care Quality Commission called What About the Children? Looking at joint working between adult and children's services when parents or carers have mental ill health and or drug and alcohol problems. So really positive in terms of that development. So I'm just going to launch a poll. So actually, when did we think that came out? So I've just launched it now. So hopefully the poll has come up for people. Yep, I can see the first votes coming through. So just a quick vote. When do we think that this came out? Is it 2013, 2016, 2019, or 2022? Okay, just give you another few seconds from that perspective as well. Okay, we'll end the poll there. So as you can see, the majority of people have gone for 2016, followed by 2019, 2013, from that sense as well. The actual answer was 2013. Joint piece of work between Ofsted and CQC. Next year will be 10 years old from that sense. And on the right-hand side, you can see in terms of a quote, and again, in terms of that quote, where that came from, in terms of was actually this year. So I sent information about this webinar and the work we're trying to do out to every single mental health trust in the country. And the positive news is actually we've got a number of them on the call now. But there was this response that I got from a mental health trust, which shows actually more than nearly 10 years on from that piece of work from Ofsted and the CQC, with all of the work being done around young carers, is actually in terms of saying there are still mental health trusts who see themselves as saying, actually, we support adults. So actually, you don't need to speak to us. You need to speak to the services for children and young people. Whereas actually, this is exactly the audience who we need to be talking to as well from that sense. So another question, I'm going to launch another poll now for you. So that was one mental health trust, which absolutely fine. It could be one person in terms of their knowledge. So I'm going to launch another poll. So our time over the summer reviewed the website of every single mental health trust in the country to see actually how much information did they have around young carers, about what support's available for them. If you've got a child with apparent mental illness, here's the information. Here are their rights as young carers if they are. What percentage of them had no information whatsoever about support for young carers? Again, we'll just give you another minute as well. Okay, last few seconds. So in terms of the results, what they were, so the results were the vast majority of people, so 59, so vast majority of people said 59%, followed by in terms of 44%, then followed by 23 and 11 in that order. And sadly, you won't be surprised to hear that actually it was 59% of mental health trusts had absolutely no information whatsoever. And the caveat I have to say is there may well be some information hidden away, but actually in terms of if us who are used to working in this area can't find it, then what chance have children and families got finding the information as well? At our time, we did a traffic light system where we rated them as green if they've got good levels of information, amber where they had some limited information as well, and then also in terms of red for zero information. And there were only 7 mental health trusts where actually there was good levels of information about young carers and what support's available. So that's really just to set the scene today in terms of what we're looking at and the conversation. So we've got a really packed agenda, so I'm delighted now to hand over to Dr. Emily Briefs, who's going to share in terms of her experiences of school staff working with children and parents with mental difficulties. I'll hand over to Emily. Thank you very much.
Great, thanks so much, Andy. And yeah, thank you for having me today. As Andy said, my name's Emily. I'm currently working as an educational psychologist in Haringey, a local authority in London. And I completed my training to become an educational psychologist over the summer in 2021. So as part of that training course, I conducted a thesis, and this was the title of my thesis. So I'm not just picking up the child, I'm picking up the family. Cool. If we go to the next slide. Thank you. So Andy's obviously gone through a lot of the kind of background context information that informed this research, as it really highlighted it as an important area. So to begin my kind of findings, I looked at what was out there already in terms of research. So parents themselves who got mental health difficulties, as well as children who are living with those parents. What are some of their views? What are they saying? So when research looking at parents' views, they talked about there being a burden of needing to share information to support their child's understanding, but also uncertainty in knowing how and what to share. They wanted advice about how to talk to their children, and they also recognised the benefits of having different sources of support and spaces available for their children to talk. So the research that then sought views of children and young people living with parents who have mental health difficulties. They also spoke about wanting information to be shared that enables them to understand how their parents may be feeling and why. They also spoke about that uncertainty and fear, so needing to seek help from trusted others outside of their home environment, which included school staff. They shared some concerns about coping in school, so how their academic performance and routines might be disrupted due to their caring responsibilities, and also feeling as though those responsibilities went quite unrecognised by professionals at school, and there was a bit of a stigma of needing to talk about them. So within all of that and all of those views that are kind of already out there in terms of the research, they speak about there being an availability of an alternative caring adult, as well as needing that information to be shared. And that's why my research kind of focused on the role of school staff in that, knowing that they provide that alternative caring adult to children in school, and also knowing a bit around kind of developmentally appropriate information to be able to share. Go on to the next slide. So Andy's already spoken about some of the legislative and professional context. Obviously, as an educational psychologist, my focus was within schools. There might be some people on the call that are kind of mental health support teams or designated senior leads for mental health in schools. So you'll know all about the legislation from the government about really trying to focus on children's well-being, that early intervention support, and being able to recognise children who may be at risk of poor mental health and some of those factors that may influence on that. As well as school staff, obviously being really well placed to be able to recognise that and recognise the home environments that these children come from. For my role as an educational psychologist as well, we're thinking around how we can work systemically with families and schools to try and understand the child's need within the context that they live. So looking at kind of then informing my research, there was a real lack of literature and research that's gone on in a UK context. So I really wanted to find out what school staff are experiencing. We see this role for them in supporting families and supporting young carers, and especially young children whose parents have mental health difficulties. So how are they experiencing that role, and how are they finding that work? Also, part of my practice of being in and out of schools, often came across the saying, there's a lot going on at home. And that really sparked my curiosity of trying to work out what really is going on at home and how difficult it can be to build that understanding. Next slide, please. So my research then was looking at gaining an understanding of the experiences of school staff, as I say, within the UK. That was done through doing individual interviews with pastoral support leads. It was all during the pandemic, so it was all over Zoom. And thinking around, asking them how they experience this work, what kind of support needs do they recognise, and how do they find this work for themselves. There was 8 participants in total, which doesn't sound like a lot, but for the methodology that I was using, that was the maximum number that I was able to recruit. But it was interesting that quite a few more than that expressed an interest to be involved. So again, really highlighting how important this area is. Onto the next slide. So the findings fell into these 4 themes, and I'm going to go through each of the themes now and talk about what these school staff are experiencing. So the next slide. Think around their first theme of compelled to care. So within each of the slides, within each of the themes, I've drawn on some quotes that the participants shared. I'm not going to read out all of them. Hopefully you're able to kind of glance over them as I share what I'm about to. But just to say that it was really powerful hearing the participants' voices and getting that data to kind of back up some of what they were feeling and saying. So within this theme then of compelled to care, the staff were noticing the perceived impact of parental mental health difficulties, whether that was through internalized behaviours, so more kind of anxiety or being withdrawn in school, or as well as those externalized behaviours, so the more outward physical behaviours that they might see in terms of kind of emotion dysregulation. Also acknowledging that it might not be the same every day, and they were needing to respond to how the child was presenting in school that day, and thinking around what may have happened at home that morning or the previous evening that would be impacting on their behaviour. Has also felt compelled to provide a sense of safety. So recognising that they often felt that they took on a bit of a parenting role for some of these children in needing to provide both that emotional support as well as a sense of kind of family home life. There was one person that spoke about having a board games group at break times and lunch times of playing with children with games that they might not have the chance to play at home. And as well as that, there was advocating for a shared understanding. So they acknowledged that it was quite difficult to build up a full picture from parents themselves, and also a lack of multi-agency support in helping them to do this. So as Andy's already touched on, maybe a lack of correspondence and speaking with the people who are working with the parents, and that information not always being shared with school. As well as needing to advocate for a shared understanding within their own settings. So the people that I spoke to were quite attuned to how the children may be feeling, but also needing to share that within their wider staff team as well. So everybody knew kind of why the child may be behaving in that way or presenting in that way. Next one was around journeying with families. On the next slide. So participants spoke about some of the challenges it was to work with parents. Sometimes there was that unpredictability, and also not wanting to have a negative impact on the parents' mental health and how they were presenting that day, as well as a bit of a lack of consistency sometimes maybe in parents' engagement, and feeling a little bit helpless in knowing how they could best get alongside those parents and encourage them and be with them as they try to support their child. And obviously within that, then there was the efforts to build trust and the recognition that it was part of their role to be able to build a better understanding of these families and the child's needs, that they really needed to work together with these families and with these parents to build that trusting relationship. On to the next slide. The next theme was around an expectation to find solutions. So participants spoke about there being quite overwhelming demands. There was complexity and conflicting nature of the demands that they faced within the school setting, of having the priorities of obviously the child's academic attainment, as well as their emotional well-being, and needing to prioritise and weigh up how they were able to offer support for that. And in that as well, it was weighing up how they could support the needs of the child, but also supporting the needs of the parents and the families they're working with. So that expectation to wear many hats was the quote that one participant used. And within this expectation to find solutions was also the weight of responsibility. They felt that other professionals or other people working with those children or the families themselves, for the staff to try and find solutions and fix the situation, as well as the pressures and weights of responsibility they put on themselves in terms of safeguarding concerns and wanting to support the family and the child's safety. The next slide then was the final theme, which is around a lot of those feelings and those experiences. So feeling frustrated, fearful, and fighting alone. So within this was the feeling of feeling quite hopeless and powerless, which obviously comes in contrast to the feeling we spoke before of trying to be a fixer and fix the situation. Staff spoke about often feeling de-skilled and uncertain about how to help the child, but also a lack of knowledge in terms of adult mental health and what support they could be providing for the parent. They also spoke about their own uncontained emotions and the intensity and regularity of that, as well as the limited space that they had for being able to process that with maybe someone external to the school setting. They also talked about fighting alone, so a real sense that they were battling to get these children and these families referred on to more specialist professionals, and in the meantime feeling like they were plugging a gap. And lastly, they spoke about a need for coping strategies, so just recognising the emotional toll of this work, the impact of this work, and needing space and to be able to kind of share that burden of responsibility, and to seek support from themselves as well. So looking then onto the summary of the implications, there were kind of four main areas that it highlighted for me. The first one was needing to work with a family-focused systemic approach. So as Andy has shared in terms of kind of how the adult mental health world is working with kind of young carers and the experiences that young children have, there's a real lack of kind of a coordinated multidisciplinary response, and a real need for these policies to promote collaborative partnerships to really help to build that shared understanding of the whole family's needs. Within that is also within schools creating those policies to reduce stigma and enable a shared understanding. So for schools to be able to cultivate sensitive and culturally responsive practice to help destigmatize help seeking and conversations around mental health, to help facilitate those trusting relationships so a real shared understanding can be built. Next one was around developing the mental health literacy and confidence of school staff. So I know there's many people on the call, I'm sure, and all of the participants I spoke to do an incredible job of supporting these children and these families, but also wanting them to feel knowledgeable and feel equipped and feel prepared for that. So a role in kind of helping them to develop their competence and literacy in that. And finally, a role, I guess, as I said, from an educational psychology perspective of how we can work to support those that work with and support children. So thinking around how we may be able to provide that consultative space and supervisory space to support the staff that are kind of facing this day to day. Last slide then was quickly just about the limitations, and I mentioned at the beginning it was quite a small sample size, so I think it'll be interesting to think around nationally. Is this something that schools across the country are experiencing? And thinking around future research as well. Obviously, this was within a primary age, but thinking with young carers' responsibilities, how they may change through secondary school, and thinking around, I guess, as well, not just mental health, but young carers in general, and how staff are working to support the needs of these children. So in terms of conclusions, then there was a kind of a national level, a school level, and a level of kind of EP and professionals as well. So that national level was really around developing the whole family approaches, those collaborative relationships between professional networks to build that shared understanding. At a school level, it will be around developing the skills to recognise and support children's needs, as well as creating those policies to enable families to seek support and build that shared understanding. And then within the educational psychology and professionals world as well, thinking around the theory that can inform some of those things that we need to understand children's behaviour, so around development and attachment, as well as being able to offer that supervisory and consultative space, recognising that this is it's a big job that we're asking for school staff to be able to do, and needing to support them in that and all the amazing work that they do. So yes, that's the end of my presentation. Thank you, Andy.
Brilliant. Thanks ever so much, Emily. And I think some of the things that you've drawn on in that sort of whistle-stop tour of the work really resonates with a lot of the themes of this session around that need for that whole family. How do we look at the needs of the whole family? How do we take that whole family approach in terms of whether it's in prevention, whether it's in safeguarding, but also being very mindful of the pressures that schools are under from that perspective, and looking at actually how can schools work with young carer services? How do schools work with their local authorities? And I know there is a lot of work going on around the mental health support teams from that perspective as well. But thank you ever so much, Emily. Obviously, if anyone's got any questions for Emily, please do put them in the chat from that perspective as well. So now I'm really pleased to be able to hand over to Jessica Radley. So Jessica has just recently completed her PhD at the University of Oxford, looking specifically at the needs of parents with psychosis and also their family members as well. So just going to take a look at actually what are some of the impacts, what are some of the issues in relation to a specific mental health condition. But thank you ever so much, Jessica. I'll hand over to you.
Hi, Andy. Thank you very much for the introduction. So yes, so Andy's already introduced me, so we can go to the next slide. I'll be able to use my time better. So what I've done is I've got things revealed. So Andy, if you just want to reveal everything on the slide. So we know that a quarter of children in the UK live with maternal mental illness, and most of that mental illness is maternal anxiety or maternal depression. So although children living with parental psychosis are a minority of these children, they are at higher risk. So they're 5 times more likely to experience a behavioural or emotional difficulty when they're quite young. And then children with parental psychosis, so either their mother or their father, are 8 times more likely than other children to develop psychosis when they're older. And they have a 50% chance of developing any mental health condition during their lifetime. And that's all these stats aren't to make it doom and gloom, but it's really to say that actually we do need to be paying attention to these children because they are at higher risk. And what can we do to help when they are younger? So next slide, please. Just do the same and feel everything. So looking at now the parents' perspective, we know that 1/3 of people with psychosis are parents. So it's a significant amount of people with this quite severe mental health difficulty. And then top right, we're looking at how all the different symptoms of psychosis, so positive symptoms like hallucinations and delusions, cognitive symptoms, negative symptoms such as feeling like they don't find it easy to express their emotions, like, feeling quite withdrawn as well. And also the indirect effects, these families are more likely to be affected by poverty, by unemployment. These will all be impacting on parents' ability to provide responsive care for their children. And the impact on the children, they're likely to experience burden, they might be taking on additional household tasks. And for some of these children, they might even experience parentification, whereby they're actually assuming the role of an adult in the family. They're also likely to be confused, not know what's going on, not know why their parents are in hospital. And then, as I spoke about on the slide before, their own emotional and behavioural difficulties. However, it's important to note that some of these children do experience resilience and empathy. They say when they reflect on their lives as adults, actually, having a parent who's experiencing that really gave me empathy for others who are experiencing mental health difficulties. And then for the parents, often they experience guilt and shame around not being able to do the parenting role as well as they'd like to. And parents with psychosis in particular have high stress sensitivity. That is, they're very sensitive to stress. And that's a very important implicator in whether they experience psychotic symptoms. And then if their children do have emotional behaviour difficulties, then the parents, as well as their own mental health difficulties, are managing their children's difficulties too. So it's all a very complex picture. All right, next slide, please. Right, so what I wanted to do with my parts of my PhD, and I'm only going to focus on the first question today, is look at families' experiences of parental psychosis. Okay, next slide, please. And so I wanted to answer, how is an episode of psychosis in a parent experienced by families? So I interviewed 5 families, which consisted of 5 parents, 4 mothers and 1 father. Then I interviewed either their partner, or if they didn't have a partner, then another family member. So I interviewed 3 partners of those 5 parents, and then 1 grandparent for the parent of the parent. And then I interviewed 4 children, so 1 daughter and 3 sons. And I really wanted to focus on children who are up to 11 years old. There's lots of focus on adolescent children when we're thinking about parental mental health difficulties, but actually, it'll be interesting to focus more on actually when these children are pre-adolescent, still really reliant on their parents. And then I analysed this data using interpretive phenological analysis. It sounds complicated, not too complicated. Next slide, please. I'll just quickly talk about that analysis. Just a brief overview. What you're trying to do is look at how participants make sense of their world, what meanings do experiences hold? So what does it mean to them to have seen their parent go into hospital? And then what's your interpretation of the data? Because when you're a researcher or when you're working with data, you're always seeing it through your own lens. And this analysis really wants to acknowledge those biases, the fact that me analysing the data, I'm bringing in my own biases, my own interpretations. So we can just skip through the things on the right-hand side. I'll get to the next slide. This is just how I analyze the data. Yeah. So this slide is showing what themes I identified or I developed using the data. So there are 4 themes. So first of all, parental psychosis impacts the whole family. Secondly, psychosis and my role as a parent. Thirdly, pressures and vulnerabilities in the family system. And finally, secrecy and concealment surrounding parental psychosis. So I'll take you through these 4 themes and then give you some quotes to back them up. So if you go to the next slide, the first theme was parental psychosis impacts the whole family. So first of all, the impact on the parent, they're experiencing terrifying symptoms and sometimes hospitalization. And one mother, she said, my worst was being unwell, was being in seclusion. I didn't like it because I felt like I was in a grave. The only thing I can remember is I felt like I was dead. And for the other adults in the family, they witnessed frightening behavior and getting hurt. So for example, one partner saw his wife, he said the police had to restrain her because she was hitting people, she was hitting me. Mostly she was hitting me, I don't know why. And then but the children, if we do the next quote, there's another quote from a partner saying she was sort of very upset. In her mind, everything that was wrong with her life or our life was because of my job, so asked the blame for everything. And the impact on the children was confusion and separation. Again, these children are younger than 11. One 9-year-old boy said to me, I was wondering what she was doing and what time my dad would come back. He just didn't know what was going on. So if we go to the next slide, the second theme was psychosis and my role as a parent. So first of all, being a parent as a source of hope. So for 2 of these mothers, they experienced mental health difficulties and substance abuse difficulties from a very young age. So one mother, she experienced psychosis since she was 13 years old. And she said to me about her daughter, I want her to be different in a way that I couldn't do as a result of my mental health. I want her to go and achieve. But for other parents, the story was different. So for one mother, her psychotic symptoms centered on parenting. And if we reveal the quote, she said, because I'm a full-time mum, I've not got a good balance in my life. All of me is to do with my children. Anything that goes wrong with them is personal. And this was really contributing to her mental health difficulties. She was so stressed about her children. And then this third sub-theme, psychosis as a threat to my role as a parent. So this is really about social services involvement, hospitalization. One partner, I asked him, did you take the children to visit their mum in hospital? He said, no, I didn't think it was a good thing. She was really confused. She didn't even remember me visiting. And then while the mother talked about being in hospital and not being able to see her children, she said, this shouldn't stop me seeing my daughter because I thought there's these people who are after me, that's her paranoia, that maybe they're after my family because I'm not there. So the separation really exacerbating the mental health difficulties. And if we go to the third theme, pressures and vulnerabilities in the family system. The first sub-theme was ruptures in the family as a source of stress. So one mother said, when my husband was away, I was unwell, but I started to get better because he came home, the importance of social support. Second sub-theme was mental health knowledge, meaning quicker access to support. So the first quote, we can see a father who knew, a partner of a parent with psychosis, who knew a lot about mental health. He was involved with his wife's care. He said, now suggest to them, I think this medication says this, or why can't you try this medication? But for another partner, he knew nothing about mental health and would hear her complaining about voices, but he said, I didn't really believe her, if I was honest. And that meant this parent with psychosis had untreated symptoms for around a year before she got help. And then how the pressures and vulnerabilities in the family system could place burden on the children. So one mother, for example, one daughter, for example, would become involved in medication management. Mum may be taking a medication. And one son identified how it was difficult when dad was away. Mum was just not enough. So if we go to the final theme now. Secrecy and concealment surrounding parental psychosis. So I imagine this will ring true to a lot of you, and it's a lot of what our time's work is involved in. So there was secrecy and uncertainty between the partners. So one father talked to me in the interview and said, that bit I just told you, she doesn't know that bit. I never told her. And one mother said, he doesn't tell me anything. Sometimes I feel like, why am I on antipsychotics if I just wasn't sleeping? She doesn't remember what she did. She doesn't even know herself. And then as a result of that, parents shielded their children. They wanted to protect their children. It was a very hard point in their lives, and I don't want to hurt them any more than they've already been hurt by it. And in the future, if it happened again, or we talk about it later on, when they're older, but not now, not now, they're not ready. This meant children knew half the picture. So one 9-year-old boy said to me, he described, she wasn't sleeping a lot. She didn't like the hospital. She didn't think it was safe there for some reason. And I think she had a cold. So he had all these ingredients, but he didn't really understand it was to do with his mum's mental health. And then one daughter described to me, she was 10 years old. She knew so much about psychosis, but when I asked about her mum's mental health symptoms, she said, I don't really know. I don't think my mum hears voices. And this also meant that although the children didn't exactly know what was going on, they still realized something was wrong at home, and they still kept the secret. I'd ask a 9-year-old boy, what's it like talking about it with me? He said, I don't know. I don't want it. It would just get in my head again, and then I'll be upset in that. So he's very young, and he's already understanding doing these kind of coping mechanisms, just pushing it out, just kind of push it down. And then the 10-year-old daughter, I asked, do you want to talk about it? She said, it doesn't really bother me that much. If I was able to talk about it, I wouldn't mind. But in my opinion, I'm not bothered. Maybe there's a bit of defensiveness there. I've just got 2 more slides. So the kind of general conclusions were about communication about parental mental illness. And it seems like there's a tug of war between parents' needs for recovery, to feel normal, and to protect their children. But the children's needs, they also have a need for knowledge, for understanding. And we know that it's protective. We know that it will help them recognize mental health symptoms in their parents and themselves. And we know that it will hopefully help them reduce self-blame and enhance self-compassion. And they might discover ways to cope with their own emotions and encourage help seeking, encourage them reaching out to other protective adults in their network. And then finally, to conclude on the last slide, we just go forward. So these children of parents with psychosis have a high risk of developing their own mental health difficulties in childhood and adulthood. And parents with psychosis want to protect their children, which can lead to children not understanding what's happening at home. And knowledge is protective of these children and will hopefully lead to help seeking and better coping. And we've got to support parents in being able to start those conversations with their children. And then just to say on the last slide, thank you very much. My email and my Twitter is there. I can't stay around for too long because I've just started clinical training. I've got to get back to lectures, but thank you very much for listening and for inviting me along.
Thank you ever so much. It's so insightful just to see in relation to a specific condition what some of the challenges were, and they really resonate with what we've seen at our time through some wider work. I know as part of the work on the mental health bill, hearing from a young person who similarly around that whole involvement of the police said, actually, when the police first came, actually because mum had run off, I thought she'd done something wrong. I thought she was in trouble, and would I ever see her again? And I think some of those challenges which just don't come into the sort of the thought process for any other young people, and often for many young carers as well, is a real challenge. So thank you ever so much for that. It's really, really interesting. So we've talked a lot in the first couple of sessions around actually the impact on the young person and on the family from that sense. But we also wanted to really shine a light on actually what could be the potential economic cost of not getting this right. What's some of the potential cost to society from that side? So I'm absolutely delighted to have John Franklin here from Pro Bono Economics. So earlier this year, Pro Bono Economics did some work with our time to really try and look at actually what is the potential economic cost of poor parental mental health and not getting the support in place for young people and their families. I won't be able to do any more justice than actually John will, so I'll hand over to John to be able to tell you more. Thank you.
Thank you very much. Thanks. It's great to see you all here and be able to talk you through the work that we've done. For those of you who don't know us, Pro Bono Economics is a charity. We use the skills of economists to support other organisations in the social sector. We do this by helping organisations measure their economic impact. We'll work around that from organisations right early stage through to delivering reports. We help shine a light, hopefully, on important policy issues for the social sector, such as the one that we're going to talk about today. And we also have a research and policy function who take a look at issues that kind of cut across the sector in its entirety and try and influence policy around that so that we can really make the most out of the social sector in the UK. In terms of this work that we've done today, if we move on a couple of slides, please. I think the first thing that struck us when we started working with Our Time is the scale of the issue. And I appreciate we've already kind of covered this in the first few presentations as well. But if it's around 1 in 3 children have a parent with elevated levels of mental health symptoms, that's the equivalent of around 4 million children. So around 4 million children out of the 12.7 million that we have in the UK today. That's an enormous number of children that are potentially affected by this kind of issue. And that just kind of immediately sets a tone in terms of the scale of this and what it is we're talking about and why it's such an important issue. And I guess that the real challenge with this issue is that there is now pretty good evidence across the board that that having a parent with mental health difficulties is likely to have negative impacts in terms of the outcomes for the children. So on average, the kind of studies raise things like elevated levels of anxiety, mental health conditions for the children themselves, struggling to connect and trust with adults, becoming more withdrawn, particularly at school, finding it difficult to engage with school and the impact that can have on their academic outcomes. And that's not to say that every child that has a parent with mental health difficulties will experience all of these effects. It's say on average, the research highlights that this is that these outcomes do happen, particularly if young people don't get the right support in place to help them. And the real challenge for this is that all of these kind of worse outcomes for the children themselves tend to be risk factors for later outcomes in their adult lifetime as well. And that leads to an intergenerational cycle. So just move on to the next slide, whereby having a parent with poor mental health makes it more likely that children will have worse childhood outcomes. And those childhood outcomes tend to be linked with worse health and employment outcomes as an adult. And that will exacerbate the risks of mental health conditions as an adult, which then restarts that cycle around. If they have their own families, then there are elevated risks once again that they will impact on their children, and potentially that creates this kind of intergenerational cycle of poor parental mental health. And this is one of the key reasons why Our Time were keen to talk to us and really understand, well, what is the cost of this cycle? What would be the benefits if we could break the cycle and actually shift policy in ways that we're giving the right support to children when their parents are struggling with their mental health? So what's the cost of this? If we just move on to the next slide, please. Now, I think it's fair to say we've taken a pretty traditional economic approach on this, and that means we've taken quite a narrow lens on this. We've focused here on impacts on wages and costs for public services. Now, we will be the first ones to admit that this is a narrow lens, that in particular, it misses out the kind of true and probably the most important cost of this, which is actually the impact on the quality of life, the impact on the kind of emotional toll on both the children and the parents themselves. So we completely recognise that, but the hope is that by focusing on some of those, I guess, more traditional economic costs here and potentially economic benefits if we're able to solve it, that will appeal, I guess, to maybe a slightly different audience who aren't as immediately bought into this as a problem, as an issue, as I guess most of the people around the table today will be. And it gives us a starting place for understanding potentially the scale of this issue. And in terms of how we approach that, we essentially stitched together 2 pre-existing studies. So there's a study that drew on the Ausback data, the Avon longitudinal study, which looked at the links between parental mental health, and specifically here it was looking at the impact of maternal depression on outcomes for children. And the measure that they used was a measure called the Strengths and Difficulties Questionnaire, which is a kind of general screening questionnaire used to gauge emotional outcomes for children. And I'm sure there'll be lots of clinicians on the call who have very mixed views about SDQ, but it is a very widely used outcome measure for children. And in particular, for us, it's very useful because there is a study, which is the second study we tied it into, sponsored by the Department for Education, that links changes in SDQ as an outcome for children through to long-term impacts on really important outcomes such as the level of wages, the likelihood of being in employment, which have significant economic values associated with them. So by combining those two studies, which use the same strengths and difficulties questionnaire, we're able to link those two together and look at, well, what's the impact of having a parent with poor mental health on the outcomes of a child as measured by the SDQ, and what is the likely knock-on consequences for that in the future for the adult outcomes. And we can then look at that for one child and then think about, well, what's that likely to mean for an entire cohort of children? So, for instance, we take the number of children that might be leaving primary school at the end of this year and use that as our kind of cohort. What are likely to be the long-term costs of that? As we move on to the next slide, the short answer is that the costs are likely to be substantial. So failing to break this cycle could cost the UK economy 1.9 billion for the children that are leaving primary school this year. And that will be felt over the long term. A lot of those costs are associated with future employment outcomes, and that's partly because of the type of evidence that is available. Those are the issues that we can really focus in on, but they are substantial. And it works out at around £11,500 per child that has a mother that has experienced depression. Which is enormous, and when we add that up to the number of children who have experienced a mother who has experienced depression, that's around 160,000 that we leave in school this year, and that's how we get up to that 1.9 billion figure. Now, it's worth flagging up and being pretty open that any estimate like this has some significant assumptions in it. When we're talking about predicting what the outcomes will be for a group of children today off 20, 30 years into the future in terms of their labour market outcomes, we have to draw on evidence that is looking backwards in terms of the outcomes for children that were born quite a long time ago, and assume that they will be the same kind of experience that children will have going forwards. And there's a number of limitations around doing that, and we'll be kind of perfectly open and honest about this. But there are also a number of reasons to think that this is likely to be an underestimate of the scale of the cost of this particular issue for the UK economy. In particular, here we're focusing just on children with mothers who've experienced one particular mental health condition, depression. Actually, if we include the impact of fathers with mental health concerns, as well as a wider range of mental health conditions as well, that could substantially increase this figure. In addition, as I highlighted just now, we haven't included those impacts on the quality of life of the people affected, both the children and the adults, and that has a cost, that has a value to it that hasn't been included here. So there's a number of reasons to think that this would be an underestimate of the total scale of the cost of this over a long period of time. But it is useful in terms of giving us a sense that this is a substantial cost and could be having a really material impact, even if we take quite a narrow look at the kinds of costs that are focused here on those impacts on labour market outcomes. So, you kind of very tight GDP focus, as well as the types of costs that affect public health services as well. So what can we take away from this? Given that there will be uncertainty about this, and we know that this is likely to be a significant underestimate. Just move on to the next slide. I think the key message is that the potential benefits from breaking that cycle, that intergenerational cycle, could be substantial. We've got a 1.9 billion figure, and I've said there's kind of reasons to expect that to be quite a significant underestimate, but it highlights that we are talking about billions of pounds in terms of the potential benefits from breaking that cycle. Now, that doesn't mean that we would immediately be able to realise all of those benefits if we were to start rolling out more support for children who have parents that are facing mental health difficulties. I think a couple of things really jumped out for us is that there's real limitations in terms of the amount of data available. So we have survey evidence that allows us to draw that conclusion about roughly how many children we're talking about across the UK, but there seem to be pretty patchy approaches taken across different parts of the country in terms of how that those issues are picked up, how they're recognised, and how they're recorded in data. So actually, for us to, I guess, roll out a response to this issue and really make a difference and change the policy over time, getting some better fundamental data around it could be pretty important in terms of building the evidence base. Secondly, that would help us understand, I guess, what can make a difference. and how big a difference it makes to the mental health of the young people with the types of support that we could have available. But it's likely that, and we've heard the kind of in previous presentations as well, increased coordination across a number of different services, which can draw on specialist services such as Our Times that have experience with working with children who have parents with mental health difficulties, could be extremely advantageous. There's likely to be a really important role for those kinds of specialist services being coordinated in amongst a wider range of services, including schools, including social services, including health services as well, to tackle this problem. And that's all I'm going to cover for today. Obviously, happy to answer any questions through the chat. Feel free to drop them in and I'll try and respond to them later on.
Brilliant. Thanks ever so much, John. It's been so insightful for me seeing this particular sort of report. I think it's often asked in terms of, is there any data around there about what the potential cost could be as well? And I think the points you've made around the need for better data really is paramount from that sense. I think we'll talk a little bit later around some of the policy opportunities coming up. But I think this really helps to show with some of the scale, some of in terms of actually the immediate impact on these children and young people, but also then the potential long-term impact, the real need to actually take some action to get this right as well. And I think when we come back after the break, we will be hearing about some of the examples where this is working already, and there is some work going on around this. But it's really about how do we scale that up? How do we make sure there isn't a postcode lottery when it comes to young carers supporting a child of a parent? We'll look at, in terms of from a policy and practice perspective, what are some of the opportunities, but also just to give you a flavour of some of the work that's being done to try and address some of the issues that we heard about in the first half of the session. So in relation to a sort of policy opportunities, I'm going to look at both a national side, but then also locally, some of the opportunities that you may well be able to look at as well. You'll be glad to know I'm not going to go in any sort of sense of detail into all of the national policy areas on the screen, but it's safe to say that these are all areas that Our Time are really, really interested in and are doing a lot of work in from this perspective. So I think if any of these are areas that you're keen to link up with Our Time on, or think how can you help amplify the message of children of parents with a mental illness, please do get in touch as well. But I think in terms of just a flavour, I think you may well have seen earlier this year, there was a consultation around a 10-year mental health and wellbeing plan. This is a cross-government initiative to really look at how do we address some of the issues around mental health, particularly in the aftermath of the main elements of the COVID-19 pandemic as well. The latest we've heard, so the consultation closed earlier this year. The latest we've heard is the new sort of minister is looking and reviewing around the mental health and wellbeing plan, and should it continue. I think for us at Our Time, we're really, really keen to see this continue. We think it's a really vital piece of work, from the impact on mental health in the aftermath of COVID, but also some of the issues we've already highlighted, that already children of parents with mental illness are not being supported as well. You might be surprised to see why we included Carers Leave Bill in here in relation to children and young carers from that perspective. But the reason for this is actually for many children and young people who are trying to combine college, trying to combine it with work, as well as supporting a parent with a mental illness, having a supportive employer can make a huge, huge difference from that perspective. Because actually for some of these young people, being able to sort of enter the workplace, it can be quite challenging for them to have the confidence to speak up and say, actually, I need a bit of time off, mum's struggling with her mental illness, or actually dad's got an appointment coming up that I need to go with him to and support him from that perspective. And so that's why Our Time and also the Young Carers Alliance are supporting the campaign, being led by Carers UK, who are also a member of the Young Carers Alliance. There is a private members bill coming up in a few weeks' time, which will hopefully give the opportunity to take this as well. So if it's something that you think you might be able to support, again, please do get in touch to find out more. We can't have a conversation around children and around the impact on them without looking at children's social care. I think there's a huge amount of focus nationally at the moment on adult social care and the pressures being faced in terms of how to fund it and also the sheer demand. But I think also the same can be said for children's social care. And a key component of the social care review was around the concept of family help. This would really build on the family hubs model, which I'll be talking about in a moment. But it gives, again, that real opportunity to make that landmark shift into looking at what are the needs of families. How do we really get that whole family approach that was highlighted in terms of nearly 10 years ago as a concept? Similarly, in relation to those children where their parents have been in hospital because of their mental illness, actually they've got new rights. They've got legal rights as young carers through the Health and Care Act. So that meant that for any adult being discharged from hospital, whether it's in terms of a sort of a acute hospital in relation to their mental health or a mental health setting as well, any carers, and this includes young carers, have got the right to be consulted. And so there's new guidance being developed right at the moment, looking at how does that work in relation to mental health settings. And so for us at our time, we're really, really keen to make sure that actually young carers are really being identified and linked into available support as well from that perspective. And staying on the theme of sort of hospitals and sort of mental illness from that perspective, the Mental Health Act is going through its biggest review and biggest reforms since it was introduced now nearly 40 years ago, so 1983. As part of this, there is a huge amount of focus around actually what the Mental Health Bill and the Mental Health Act should be for, who does it include, what are some of the provisions. And for us at our time, we see this as a really fundamental opportunity to make sure that children of parents with a severe mental illness are both identified and linked into existing support. And I think you'll see at the bottom of the slides, actually, in terms of it gives us an opportunity to learn from other countries. I think it might be surprising to some to hear that actually the UK and England are seen as one of the leading countries internationally, when it comes to policy and provision and rights for young carers. Often there are issues around implementation, but actually we're one of the leading countries if you look internationally. However, there are other countries when it comes to children of parents with mental illness who are actually further ahead than us. So countries such as Netherlands and Norway, they actually make it a mandatory requirement to be identifying whether there are any children when there's someone with a mental illness. So whether they're being discharged from hospital, getting support from a mental health setting. So we're really keen to see the Mental Health Bill as an opportunity to say, how do we identify these children? How do we get that whole family approach to support as well? And the final one I'm going to touch on before is around mental health support teams. So we talked earlier in the session about some of the pressures being faced by schools and also the challenge around mental health and the mental health of young people as well. And so for our time, we really believe in actually having a much greater focus on mental health, having much wider conversations around mental health within schools, because this gives a really good opportunity to encourage young people to come forward. If you never talk about mental illness in schools, if you never hear anyone talking about it, why would you come forward and say, actually, my mum's struggling with her mental illness, or dad's been taken to hospital because of his mental health from that perspective as well. So one of the Young Carers Alliance members, Bernardo's, is similarly leading some work to try and make sure there are mental health support teams in every single school as well. So if there's any of these you want to find out more, please do get in touch with me. I'll put my contact details later on as well. And I haven't touched on Triangle of Care. I'm delighted we've got Sharon from Carers Trust who will be talking all about that slightly later. But it's not just all national. There are things already in place which you can make sure, how are these working in my local area? So as I mentioned, the family care hubs is a new sort of model that is really being promoted in terms of a sort of a way of working to really look at in terms of how do we support families in that sort of that preventative model, that early help approach to supporting children and families as well. So this is a really good opportunity to make sure that as part of this, there will be lots of families who are accessing the family care hubs. Actually, there is parental mental illness within it as well. Similarly with the integrated care systems, these launched earlier this year, back in July. And I think the challenge to anyone on this call is to say, actually, how is my integrated care system? How is my integrated care board making sure that any plans around mental health, any plans around sort of health services really are sort of highlighting how do we identify these young carers supporting a parent with a mental illness? What does the support look like for them? They've got a key role to play and make sure there are services to be able to support these children as well. And I touched right at the start of this session around mental health services. And this can be something as simple as making sure that that traffic light system I talked about earlier, actually, if we were here in a year's time for World Mental Health Day next year, say, actually, we've gone from having 7 trusts with having good levels of information to every single one of them. So reviewing, actually, what does your mental health trust information look like for young carers? Does it talk about young carers having legal rights that they have to an assessment? Does it talk about what young carers support is available? Similarly, how it does for adult carers as well. And I think there are other things that could be done as well. So how do we make sure there is that joined up approach? So I've put a link in the slides here, which you'll get later on, is about how do we make sure that adults and children's services are working together to support young carers and their families. There is a whole memorandum of understanding that's been around for, again, a number of years. 2015, this came in. How do we make sure this is working in practice so that actually that quote you saw on that first slide becomes something that we don't ever see again? So that actually making sure that adult services see identification and support for young carers as equally part of their responsibility alongside children's services, the voluntary sector, health partners, schools as well. And then the final couple of things that I really want to flag on from this perspective in terms of local opportunities is the school census. We've got a whole webinar coming up on this on the 2nd of November for anyone who's interested. But in case you're not aware, from January, every school in England will be needing to report on how many young carers they've got in their school as part of the school census. It's a data return that they do 3 times a year. And this is the first time that young carers have ever been added to the school census. It's something that's been called for a number of years, because this will really help to improve the identification and support for young carers, both within schools, but also locally as well. The school census will also give us that opportunity to look nationally as to how many young carers are there, what is the impact on things like attendance, things like attainment as well, to really help them make the case for where support is needed. And so at Caring Together, what we've done in terms of around the school census is actually set a challenge. So we've worked with our local authority in Norfolk and also partners in Cambridgeshire and Norfolk to really set the challenge for schools to say, ahead of the school census, how do we make sure that every young carer has someone in their school they can talk to? How do we make sure that every young carer knows what help is available to them, both locally in their schools, but also locally in their areas as well? And again, if these are areas where you think, actually, how do we make sure that opportunity is not missed in our local area, please do get in touch as well. And just to say, I've seen a couple of comments coming through in the chat, just to say in relation to Wales. So it's not currently asked at the moment, but this is conversations I've been having with colleagues at Carers Trust in Wales about how do we make sure they're identified as well from that perspective. And again, there's been lots of work around young carers up in Scotland as well. And then in terms of the final piece of work, our question was around colleges and universities. And again, historically, there's been a lot of focus on young carers in schools over the last 5-10 years on a national level. So through the Young Carers Alliance, we're really looking about how do we increase the identification and support within the college setting? How do we make sure that young carers are supported to be able to go on to university if that's what they want to do as well? So there is a huge amount of work going on around how we sort of identify and support young carers throughout that educational life cycle as well. And then finally, for those of you who either work for young carers services or you might be a commissioner of them, thinking, how are we meeting the needs of our young carers? How are we addressing some of the specific challenges that might be coming up for them from that perspective as well? And so later on, you're going to be hearing from my colleagues, Dimpna and Helena, about our Kids Time workshop. And there are examples of young carers organisations in different parts of the country who've actually adopted this model, who've licensed the Kids Time workshop to be able to incorporate it into their young carers offer to be able to support those young carers and their families as well. So that's really just a flavour about some of the different opportunities coming up as well that you might be able to find out more about, or please do get in touch with me. I'll be more than happy to go into much more detail about any of these as well. And so then the final thing just to really flag is in terms of we're at Caring Together, we're a member of Young Carers National Voice. So this is a network of 23 young carer organisations, all committed to young carers participation. And as part of this, the young people in this have actually produced some resources aimed at mental health services. So they've got top tips for mental health professionals, and they've also got example wording that's been developed with young carers to be able to say, how can they help identify potential young carers within the work that they're doing as well. So there is a link in the slides to be able to access them, but if you go onto the Young Carers Alliance webpage, you'll be able to find them as well. So I'm now going to move on to our first practice example and to be able to sort of share some of the examples of work being done. So I'm absolutely delighted to be able to invite Lois Gallagher, who's the Move On Up Tenant Support Manager from Quaker Social Action, to be able to talk about some of the work that they've been doing, particularly around this group as well. Thanks, Lois.
Thanks, Andy. Hi, everyone. Hope you can hear me all right. I'm Lois Gallagher, and I'm going to talk to you about Move On Up. I'm just trying to move my screen here. Right, that's it. So Move On Up is a project that's run by Quaker Social Action. And it's a project that meets the housing and support needs of young adult carers. So we provide 2 years, usually about 2 years of tenancy to young adult carers who are aged 18 to 25. And our properties are all in North and East London. The tenants live in shared houses. So we have 4 houses, each with 3 bedrooms. It's a really small project. So everybody shares with 2 other people. And the rent is really affordable. That's a really important part of it. So we charge £520 a month in rent to our tenants, and that includes bills. So this opportunity is so that tenants can experience independence and learn essential skills in sharing a house with other people that they are not related to, learning about how to maintain a tenancy, and also being able to develop skills in terms of their more personal development, whatever that might be for them at their point in their life that they want to achieve. So the way that we do this is we provide to each person tailored personal support. So each tenant receives at least once a month a support meeting, and the support is based on a coaching model, life coaching model, and that can be very practical support, or it can be more psychological therapeutic support, depending on what each person feels ready for and want to explore about themselves. So we really tailor the support to each young adult carer that we work with. Next slide, please. So Move On Up and parental mental illness. We find that the majority, it's about 3/4 of our tenants care or have cared for a parent with mental ill health. But we also find that this often coexists with other things such as physical ill health, substance addiction, and poverty. So these are the issues that are bringing young adult carers to our project. But overridingly, it's parental mental ill health that they're primarily caring for. And all of the young adult carers who do care for parents with mental ill health in our project are also experiencing challenges to their mental health. So that can range from experiencing persistent low mood, through to anxiety, through to symptoms of trauma and PTSD, sometimes periods of suicidality, and also personality disorder diagnoses. So there's a real range in terms of their experience with mental ill health themselves. And around half of these young adult carers who care for a parent with mental illness did talk about having experienced abuse or neglect during their childhood. Next slide, please. So why do we want to provide housing for young adult carers? Why is that important? Well, I'm sure you will probably know that young adult carers and young carers often miss out on typical milestones and opportunities. So that could be all sorts of things, gaining qualifications at school in education. Another one is moving out of the family home. It's really difficult for young adult carers to do that for financial reasons, for more relational reasons, for all sorts of reasons. It's really difficult for them to have that opportunity to reach that milestone and that rite of passage that's often involved in becoming an adult. But also we found that for our young adult carers, living with parental mental illness tends to place a real strain on family relationships. So sometimes the young adult carers that we take on, they're really struggling to stay in the family home. It's becoming such a strain for them, or they've already moved out and they're living in insecure housing, perhaps sofa surfing on a friend's sofa, and they really need somewhere to live. And physical and psychological separation are harder to achieve for young adult carers. There's an experience they often have of becoming merged with their parent. And we know that separation, especially psychological separation, is so important in the process of becoming an adult. So having independent living can really help with that. Next slide, please. Okay, so what are the challenges of providing housing for young adult carers who care for a parent with mental illness? Well, our young adult carers often find it very challenging to live together. They do struggle sometimes to make successful relationships, and that can be borne out in the house sharing experience. But many also form strong friendships with each other, and this is a really important developmental experience for them, to experience having good, successful relationships. And they often need quite a lot of support to learn to identify and meet their own needs. They've often had to suppress their own needs, almost to the point where they have forgotten they have needs. And so the support relationship sometimes encounters quite a lot of challenges in helping them to identify and meet their own needs. But again, this is such an important developmental experience for them to do that. Sometimes going into a safe space of their new home with us can result in a sort of delayed adolescence. So we get quite a lot of sort of adolescent behaviour, acting out, trashing their rooms, not paying rent, lots and lots of different ways of expressing perhaps adolescent behaviour that hasn't been possible to express before in the family setting. But again, this can be a really developmental experience for them if they can do that, and then we can help them to think about what's happening. That can be a really important experience for them. And we do a lot of work around helping our young adult carers to prioritise their rent payments. That can be very challenging for them. They're usually on low incomes, and they are very often caring for their parents financially as well. Next slide, please. So here are some quotes from some of our young adult carers. The first is from a young woman who came to us having cared for her parents for many, many years. Her father had a diagnosis of schizophrenia and her mother of long-term chronic depression. And she also cared for two younger siblings who were much younger than her, twins, and she became one of their primary carers. She said, "I can care better for my family after going to my own space and caring for myself." So by the time she left us, she was still caring for her family, but in a much more boundaried way. She was working full time, and she actually moved into her own one-bedroom flat that she rented, which was near her family home, so that she could still go to see her family a lot. The next one is a young woman who is living with us at the moment and is caring for her mum who has bipolar disorder. Living separately from my mum has helped me to realise that when my mum's in a bad mood, I don't have to be in a bad mood. So she's really working on that psychological separation that's so important at that age, where she can have different feelings and experiences to her mum. And then a young man who has cared for his mother and his siblings. Mum had undiagnosed mental health problems and substance misuse problems. And as a child, he was often left to look after his siblings, sometimes with no warning and sometimes for several days. And he actually has a diagnosis himself of borderline personality disorder. He says, "I want to spend time with my family and they need me, but it's much better for me to live somewhere else." And next slide, please. Okay, so Move On Up was set up as a 7-year pilot project. It's a partnership project with Commonweal Housing Association. And so it's actually due to end in next summer. So we're working on our exit plan at the moment and supporting all of our tenants to move on. We do provide financial assistance for our tenants to move on from us. So we pay their deposit on a new place to live, and we give them an allowance for sort of to buy new furniture and things like that. So we help them to move on, because moving on can be really challenging for them. So unfortunately, Move On Up is ending, and we're now going into the stage where we really want to share our learning and influence as much as possible both the carers and the housing sectors, because we're finding that still housing is really not being talked about very much in terms of young adult carers' needs. And we want to raise the voices of young adult carers who come to us and tell us that their housing is actually really, really important and is so key in terms of their well-being. So look out for some more sharing of our learning over the next few months. If you want to have a look at our website, it's quakersocialaction.org.uk, and you can find Move On Up on there. And we have a report, an evaluation that's already been written by the Learning and Work Institute. That was a couple of years ago. We had a sort of mid-project evaluation, and we'll be doing a final evaluation as well. And really keen to influence the sectors in terms of the housing needs of young adult carers, and to kind of encourage that conversation to be had more. And that's it. That's me. Thank you very much.
Brilliant. Thanks ever so much, Lois. And it is such an important topic, because as you rightly say, housing often comes up for this sort of age group as a real challenge. But I think that link between the housing world and the carers world is one which I don't think has really been sort of brought together in a sort of really coordinated or sort of on scale. So really, really appreciate you taking the time to sort of share that work as well. And I'm sure people be more than happy to get in touch and Lois will answer your questions as well. So we're now going to go on to another one of the sort of policy sort of sides of things to really help people be aware of some of the developments as well. So following on from what I talked about earlier, you saw that Triangle of Care was something that I was mentioning as well. So I'm absolutely delighted that we've got Sharon Sperling, who's from Carers Trust, to be able to talk about actually what the Triangle of Care is, and again, how this can sort of play out in your local area as well. So without further ado, I'll hand over to Sharon.
Thanks, Andy, and thanks for the invite to speak to everybody today from the Alliance and from our time in Caring Together. I hope I can keep you engaged. There's lots of hard acts to follow from this afternoon, so we'll see how we go. A little bit, first of all, about me. I'm Sharon. I am the Triangle of Care Programme Lead, and for my sins, I also at the moment head up network development, supporting all our carer centres across the UK, and there's 127 of those. Carers Trust is the largest infrastructure organisation for carer services in the UK, and our role is to support those carer services to deliver to carers. We do a lot of work on impact and developing outcomes and impact tools, much influencing and policy work, so the voice of carers is heard locally, but also at national government levels. And we have a young carer and young adult carer teams who have a fantastic internship programme, but do a lot to support that voice of young carers as well in influencing decision makers. And we also give grants directly to carers, but also to our carer centres to deliver programmes of work and projects, particularly around the innovation. So the vision of Carers Trust, and I think this really aligns well with what the Triangle of Care is about, and that's that unpaid carers are heard, valued, and have access to the support, advice and resources that they need to live a fulfilling life alongside the caring role. And I hope that will come through as I talk a little bit more about Triangle of Care. Next slide, Andy. So this is the Triangle of Care, and I'm going to start off, I think, to describe how we got to the triangle. So around, I think it was about 2010, groups of mental health professionals working in mental health trusts and carers got together to look at how they could work better in partnership for the benefit of all the staff, but also for carers and service users, patients who are receiving treatment. And they kind of looked at what was the existing linear model, where the service user would be there, the clinician would be there, and the carer would be there. And so family members, friends were talking to the service user were talking to the clinician, but nobody was talking to each other. And so that's what developed the triangle. So those dots in it represent service user, clinician, and carer. And it really is a partnership approach that promotes safety, supports people's recovery, but also sustains the well-being of everybody within the triangle. So at the moment, there is something like 43 mental health trusts that have embraced the triangle of care approach. And I would say that in many of those, that's absolutely embedded as business as usual. But we should also remember that the triangle of care approach is a journey. It's not just about reaching the destination. It is about culture change. It is about working together collaboratively with carers and service users to develop systems and practices that promote that understanding that everybody has expertise in their care. I'll be honest with you, Triangle of Care has been a bit of a roller coaster, like any third sector organisation. It's been heavily linked to funding. And so at some point it's been really well resourced and at others not so much so. And during the pandemic, we did pause some of our asks from the Mental Health Trust because, you know, really people had enough pressure to be dealing with. But that also led us in 2021 to review how the Triangle of Care was going. We brought some external consultants in to help us with that. And that led to a Triangle of Care programme lead role being created, which I was delighted to be appointed to, and also an ongoing relaunch of the Triangle of Care in this year and in next year. Some of that's about how we invest in Triangle of Care. So there is going to be a fees model around application and accreditation. I think that's fine. I think it values it. But that also means we can really invest back into the Triangle. Some of it's about reviewing, which I think I'll come back to again later on, because that's where I'm going to ask for your help. But also it's around the setting. So at the moment it's in mental health trusts, but actually it should be wherever carers and young carers have interactions with service providers. So in physical health settings, and some mental health trusts that are integrated already apply it in their physical health settings, but for private provision and also for voluntary sector provision, and also in social care, because I think that's also incredibly important. Next slide, please, Andy. So why was it developed? So it was a set of standards that were developed because people understood that the carer relationship was not always recognised, that carers were not always given the key information or involved in planning, that their needs weren't met. And I think this is one of the very key standards that I'll come on to in a second, that carers' own health and well-being isn't always recognised. It helped build relationships and confidence, and it therefore reduced complaints. If people are talking to each other and understanding what's happening, you're less likely to become frustrated. But also it recognises, and this is really important, it recognises the carer's unique and expert views onto the service user, which could have been missed previously without the triangle. And I would include young carers in that as well. Next slide, please, Andy. So the 6 key elements of achieving a triangle of care that those who go through the accreditation need to achieve and to evidence are identifying carers early, having carer awareness and training to ensure that they can engage with carers well, and that includes young carers. to have policy and practice in place that covers things like confidentiality and sharing information. And I know earlier in the chat, Janice mentioned about consent, and I think that's really important. You can share information if consent's not there. You can have conversations about treatment, about what the pathway looks like. You can talk about what's going to happen at discharge. So it's really important that those policies and practices in place. We call it common sense confidentiality, if you like. Services should have defined posts that are responsible for carers. So most services have things called carer leads or carer champions. And it's really important that that engagement is from the top right through the services. So at direct level as well. And it needs to include carers at all stages and ages. There should be lots of information available for carers. So information packs that covers what they might expect, gives them their kind of frequently asked questions, and it needs to also be age appropriate. So whoever picks up that information can get the information that they need and they understand. And carer support, I talked earlier about carer health and well-being, and it is super important. There is something around there supporting carers who are involved with treatment services. So I mentioned about the work that we do at Carers Trust. We've got 127 carer centres across the UK, covering 78% of local authority areas. I think it's 90% in England. And last year they worked or registered over 900,000 carers, and they did direct support with just a little under 47,000 young carers and young adult carers. So there is support out there, and I think it's really important that it has to be local support. So if you're in a mental health trust, you should be working closely with those local support networks, whether they're within Carers Trust network or outside of that. So young carer services are super important as well. Bring that collaboration in, bring in their local knowledge, because that's what's really useful to carers and young carers. 69% of our carer centres, I think, sorry, 69, not percent, 69 of our carer centres provide young carer specialist services. So it is out there. Next slide, please, Andy. I wanted to repeat what's been shown before about the 1 in 3 children in the UK having a parent with poor mental health. So I've shamelessly stolen this. I'm sorry, John. I hope you'll forgive me. But I think it's absolutely important when we think of the standards and we think of young people. It's super important that the young people are identified. It's super important that staff are young carer aware, that they've got those kind of procedures in place that supports young carers, that they have the right information for them, and they have a range of support services available. And I've just seen someone, I think Janice again in there, saying about using carers prescription or referral tool to refer carers to third sector carer support. Action for Carers is one of our network partners. That's brilliant. Thanks, Janice. So the standards absolutely can fit into young people if the training, if the awareness, if the understanding is there. Next slide, please, Andy. So one of the things we did back in 2015, and this is where I'm going to need your help in a bit, is with in partnership and co-development with young carers, developed the Triangle of Care Guide for Young Carers, and I've got a hard copy here, I don't know if you can see that. And that looked at what good guidance would look like for staff members within mental health services to support young carers. And it came up with things, you'll see these bullet points here, but it was about identification of young carers. So the need to always ask about young people in a household and the help they might provide in supporting services. It was a real clear pointer that just don't make the assumption because you've not seen a young person, they're not involved in support and care. There's something about the word carer. I'm a carer, but I don't regularly label myself as that. I label myself as Sharon, a wife, a friend, and not someone. So be a bit cautious about using care as a label and ask people how they want to be identified. The need to be flexible. So services should be aware that young people, school or university, or even working young adult carers, you might need to be flexible in those appointment times, or how you might speak and give young carers the opportunity to speak to you. Being open and honest about conditions and treatment. Again, that common sense confidentiality, that you can talk to young people about what's going on, what's happening in services, what the treatment might be like, how you are planning for discharge. And you can do that without breaking consent. And if you have consent, that obviously makes the conversations easier for all. It's about that active listening. So finding safe space for people to have those discussions, and information that works for them. Back in the day when I used to run a carers centre, I worked with a young person's support service to develop an online guide that just talked about caring and conditions. So there were links through to really good resources, not written by us, but written by other people that could speak to young people about who wanted to find out about a condition. So it's thinking about how you might develop your information pack to include that. And it's absolutely about involving support services for young people, involving young people in that, but also involving the wider support service. And I noted we've got Bernardo's, for instance, on the call here. It's using that wealth of local knowledge to make it easier for young people with caring responsibilities to be able to interact. Next slide, please, Andy. I think this might be my last one. Yeah. So I mentioned about the help we might need. So that document that I held up was reviewed in 2015. Part of our relaunch of Triangle of Care is to review all the documents that we have, all the guidance, all the toolkits, and there are very many of them. So part of that review, I will be calling on people to help with that. I will be calling on people to help us co-develop, and with carers, young carers and young adult carers and parent carers as well, when we're thinking about young people who might be in mental health treatment, to support us in that development. So don't be surprised if you get a shout out via Andy from me. And I hope to be able to hang around a little bit after the session if anybody's got any questions. Thank you very much.
Brilliant. Thanks ever so much, Karen. And I think it is a really exciting opportunity to make sure that, as you said, lots of trusts are already signed up to the Triangle of Care, but say actually following on from where COVID has left us from that perspective, but also that chance to look at where the young carers fit into the mix. I think there are trusts where it's been very adult carer focused, so they've got carers leads in the adult side of the world. How do we make sure that it's young carers focused as well? I have put a link in the chat to the document that Sharon's just held up from that perspective, so if anyone wants to take a look as well. And I think that point you made, Sharon, around that partnership between sort of mental health trusts and young carer services is really, really vital. There are lots of great examples of where that works really well in practice. So, for example, in Norfolk and Suffolk, for the past 3 years, the Mental Health Trust has organised something called Reach for the Skies, which is a specific event for young people supporting anyone with a mental illness, so parents, but also siblings and other family members as well. And that's provided a really good opportunity to sort of bring young carers together with staff in the Mental Health Trust, as well as doing something fun at the same time as well. So I think there are lots of great examples out there as well. So our final session this afternoon is going to very much focus on, again, another practice example of just some of the ways in which you can support this particular group. And so I'm delighted we've got Mcgowan and also Helena from Our Time, two of my colleagues, who are going to talk to you about the work that we do and just some of the ways in which that we support children of parents with mental illness as well. So I'll hand over to Dimna and Helena.
Thank you, Andy.
Hello.
Dimna, are you there? You might be muted.
I am muted. I'm here now. Thanks, Helena, for telling me. Good afternoon, everybody, and thanks, Andy, for organising this very important forum for sharing. My name is Dimpna Kanan and I'm the Chief Executive of Our Time charity. And Helena and I are going to tell you a little bit about the charity and about what we do and how we support children of parents with mental illness, many of whom are young carers. So Our Time is the only charity, and if you could, yeah, thank you. It's the only charity that specifically supports children of parents with mental illness. So we're complementary to a lot of the other support that's available for where families have a parent with a mental illness. And we have spent the last 20 years, the charity has spent the last 20 years thinking about the impact of parental mental illness on the children and what could be done to support them. So over that 20 years, we've talked to families, we've talked to psychiatrists, we've talked to schools, and all kinds of people who meet these children. So all of our work is based on consultation with people with lived experience and also the people who provide support to those families. So we have also done a lot of pulling together research and also doing our own research around what works for these families and what makes a difference to them. We give the children practical support in their families and in their schools. And that means that we have community-based workshops, which Helena will tell you about in a few minutes. And we also work with schools to help them to identify and support the children at school. It's quite a challenge for families to come to community-based workshops and bring their children because our approach is a whole family approach. So those children who don't have that kind of support in the community, they're all at school, and therefore it's really important that school staff are able to recognize them and support them in school. In addition, we train professionals to identify and support the children early on. So anybody who meets in their professional life these children really need to know how to support them, how to recognize and support them. What we know from our experience with talking to professionals, whether they're teachers or social workers or mental health workers, that they do understand and know that this problem exists, but they are often reluctant to address the issue either with the family or with the children. And that's probably because of stigma, but it might also be wondering, what can I do after I raise that subject? So there's a reluctance on behalf of professionals, and that's what we hope to address in the training that we provide. The last point, we campaign for government to recognise that these children have specific needs requiring specific support. So it is quite different to be a carer for a parent with a mental illness to being a carer for a parent with a physical illness or a disability. Not to say that one is more important than the other, or to say that they don't overlap very often. But it is really useful to know the kind of specific challenges. One of them being stigma prevents children of parents with mental illness reaching out for help or disclosing what's going on in the family. So there are things we need to do in order to address those challenges. Next slide, Andy, please. So our approach is based on three key principles. The first one being helping the children to know that they're not alone. It's often a huge relief for children to find out that there are other families who have similar experiences. And most children think that they're the only person who lives in these circumstances. And that's mainly because there's a huge silence around parental mental illness and mental illness in general. And there's a stigma around saying anything about it. So it's really fundamentally important to address the stigma and to address the isolation. So for children to know that they're not alone, and this is fairly common, in fact, as we can see from the statistics, is a massive relief and enables them to open up. A good explanation, we've heard from all of the research that we've seen earlier on this afternoon, that a good explanation is really protective for children. It's very damaging for children to not know what's going on in the family, or not know, for instance, that they're not to blame. Children often feel that if only they could be better behaved, a better support, they could make their parents happy or make them well. And a good explanation busts a lot of those myths and provides age-appropriate, good explanations that the children can understand, that's not in medicalized language or in language which labels the family. The third pillar of our work is having a trusted adult to talk to. That can be a member of the family, it can be a grandmother, it can be an aunt or an uncle, but it can also be a teacher. And in our workshops, we find that the children form very good bonds with the staff who run the workshops, and they are often the trusted adult. But the child will decide who they can trust, and it's important that adults in different settings, whether they're at school or they're in the family, are willing and open to being a trusted adult, and know that they can't fix the problem, but they can be a listening ear and they can be somebody who cares. Next slide, please. So I'm going to talk a little bit about how our interventions support the government agenda, because it's really important that we're not alone and that we fit into policy and practice and what works. So we work with the whole family, and that's something that has become increasingly important and talked about, because the children live most of their lives in the family, and if there's a problem with the parent or there's a problem with the child, it affects the whole family's well-being. Our work is place-based. In other words, we are community-based, and we work in a specific geography to bring out the importance of dealing with this group of children who have a parent with a mental illness, and find and connect all of the support that exists in a particular place, form partnerships in that community to help those children to get the help that they need. And we have a lot of evidence, and we collect evidence together from our own projects and also from international research. So all of our interventions are evidence-led. Trauma-informed, meaning that we work not to blame or to try and fix the problem, but to think about what's going on in this family and what could we do to help the children to become more resilient. So it's not about intervening in the family to find out what's going on just for the sake of it, but it's about thinking about what's happening in that family and what's happening for that child, and what can we do to support them. Our work is systemic. In other words, we don't look at the individual child as an isolated individual, but we look at the environments in which the children grow up and in which they develop. And the main ones are obviously the family and the school, but also society in general. So it's looking at how we can make the environments in which children grow and develop safer and more developmentally friendly, more compassionate and understanding. And we address the impact of adverse childhood experiences. And many of you will know the research on adverse childhood experiences, or ACEs, and parental mental illness is one of the 10 which causes the most stress on the children. There are other ones that are closely linked, like substance misuse, like parental absence, family breakup. All of these are part of a group of things which occur when there's a parent with a mental illness. Not saying that they are causal, but they often come together. So addressing the needs of parents and supporting the parents to be the parents they want to be, and supporting the child to develop supportive relationships and trusting relationships will help to address the other ACEs as well. We enable and encourage early identification and support needs. It's really important that the children are, what we do is try and prevent problems happening. And it's often difficult to get funding, and it's often difficult to get attention for something that hasn't happened. But we also know from all the research and the government agenda that early intervention is fundamentally important to help to build resilience before symptoms start to occur or a crisis is reached. Next slide, please. So I'm going to hand over to Helena now, who's very close to the Kids Time workshops, which is one of our family interventions. So over to Helena.
Thank you very much, Dimpna. I'm conscious of time, so I'm going to have to go through these slides quite quickly, but as Andy said, a recording will be available afterwards, and very happy to share the deck. So our Kids Time workshops, they are our community-based intervention, and they are multi-family workshops for whole families in which one or more parents has a mental illness or a mental health difficulty. They take place monthly after school for around 2.5 hours, and any agency can refer into a Kids Time workshop, and families can also refer themselves, and several of our families actually do proactively approach us, which is great. In the Kids Time workshops, we, together with families, we learn about mental health and open up the conversation about mental health. And we do that in a variety of ways and methods. So we use mental health education, psychoeducation, but also there is a strong emphasis on games and drama for the children, and creating a safe environment for the children where they can play, socialise with one another, de-stress and have time to be children and free of their day-to-day worries and responsibilities. So there's a real focus on helping young people to de-stress and find their voice in the workshops, as well as learning about mental health and mental illness and getting those explanations. The Kids Time workshops are delivered by local teams, so people who are on the ground in the communities, who have that local knowledge and understanding of their communities and their needs, and they receive specialist training in the intervention by our time. And how that works, or how that is allowed to happen, is that we have a manualised approach for the Kids Time workshop. So we have a license for working with different partners, and that includes local authorities, NHS partners, and other charities. And how we stay connected with all of our workshops is through our community of practice. So we have a national network that brings together all of the Kids Time workshops across the country, but also Kids Time workshops that are taking place in other countries too are linked together through our community of practice. Next slide, please, Andy. So what difference does it make, and who are we reaching? So we're currently supporting over 400 children and 200 families across 16 locations in the United Kingdom. From our most recent impact report, we know that over 50% of our families are single parent households. So we will have children living in a single parent household with a parent that has a mental illness, and quite possibly we know anecdotally and from our data that very many of our children and young people are living with parents who have more than one mental health diagnosis. And we have the stat here as well that over 30% of our parents have more than one mental health diagnosis. We are very closely linked to local authorities, and astonishingly, or perhaps even not surprisingly, over 50% of our referrals come from local authorities, and that's either children's social care or early help, which really indicates that there is a need for this specialist provision, and that the Kids Time workshops help to address a gap for this particular group. We carry out regular impact evaluation, and recent results from our strengths and difficulties questionnaires carried out with children have highlighted the following outcomes, and these are after 6 months of attending the Kids Time workshop. So children and young people have been reported improved peer relationships and social skills, having more friends and being less lonely as a result of coming to Kids Time. They report reduced physical symptoms of anxiety and stress, and improved concentration and focus. Parents also report an increase in confidence, as well as feeling less stigmatized and isolated. We also encourage the families to set goals when they join the workshops as a family, and then we review them every 6 to 12 months. And the results from that have shown us that sort of the overarching theme of that is that families report improved relationships and feeling more able to talk about mental illness together. Next slide, please, Andy. And I just wanted to end sharing some case studies and testimonials from our children and parents. So here are two of many examples of what children and parents say about coming to Kids Time. So Mina says, I normally worry about mum a lot. I normally worry quite a lot about things, but coming to Kids Time, it just lets me open myself up, and I don't feel I can do that anywhere else. Parent says, Kids Time means a lot to me and my daughter. To be able to share in a safe place and not be judged, but to be welcomed and understood by staff members is a great help. And then the next slide, please, Andy. Thank you. And as Dimpna mentioned earlier, we are working increasingly with a lot of local authority partners and in an integrated way, because the Kids Time workshops offer an integrated package that supports the priorities that local authorities have for children and families, and we work in a holistic way. So here's a quote from the head of early help at Westminster City Council. We've been working with them in partnership for 2 years now, and they've integrated the Kids Time workshop as part of their family hub and have trained up their early help practitioners to deliver the work. So I'm conscious of the time. I have also included some information about our schools work, but I think that will have to be shared after the session. So thank you very much, Andy. When we share the slides, you'll see here links to further information. So please do sign up to our newsletter to find out the latest news from our time. Please do download our podcast. It is fantastic. We have interviewed quite a range of well-known people who have grown up with a parent with a mental illness and gone on to do some fantastic and inspiring things, so you can hear their stories there. Lots of free resources available for professionals and schools on our website. I've included a link to donate, and if you're interested in finding out more about the Kids Time workshop model or would like to set up a Kids Time workshop, please email us and we'll get in touch and set up a consultation with you. So thank you so much for listening.
Brilliant. Thanks ever so much, Dimpna and Helena. And as Helena said, when we send the slides around, it also includes information about the work that Our Time does with schools. So we do a huge amount of work into the raising awareness with schools and with young people around mental health, because again, that can then really encourage them to come forward. And there's a whole program of different things, from PSHE to awareness raising and training for school staff. So please do check that out on the slides, and please do get in touch if you'd like to find out more as well. So just left for me now to say a huge thank you for everyone for coming today. It's been absolutely brilliant to have over 200 people on this call, and hopefully you found it in terms of useful to really help around some of the impact of this particular group of young carers, but also some takeaways as to actually what can you do in your role to take this forward? What can you help support Our Time, Caring Together and Young Carers Alliance to do on a national basis? Because you'll have seen that at Our Time, we are a small charity, but we're one that's committed to making a real difference for children and parents with mental illness. So in terms of all of the work that we're done is reliant on the feedback that we get from people who are attending. So I will be sending around afterwards a sort of a Survey Monkey link. Please do take a couple of minutes to give some feedback on it as well. I've got on here the dates for your diary. So we do regular webinars on different topics as well. So you can see we've got young carers and the school census, young carers and health, and then also how to improve the health and wellbeing through the use of sport. If you're not yet a member of the Young Carers Alliance, it's free to join. It's open to organisations, to individuals. There's no geographical sort of boundary as well. So please do get in touch if you're really interested in helping to improve the identification and support for young carers, young adult carers and their families. A huge thank you to all the speakers for giving up their time and sharing their expertise to get today. And thank you again for coming. Much appreciated.